What would you define public health as?
As soon as I hear public health, I think of people going on service trips and helping other people. I think of my friends who are those majors. Public health is just the act of helping people in some type of way.
Public health is the general health of the community.
Public health is the health of the public, which means that you want to make sure that everybody is taken care of.
Hello, my name is Emily Lombardi. I'm a faculty member in the Baldwin Wallace University's Department of Public Health and Prevention Sciences, and I'm here to talk about public health. Public health is the idea of looking at health from a much broader, perhaps even a holistic perspective. That is, everything that we do in our life is public health, from the air we breathe, the water we drink, the food we eat, and even with the people we meet and interact with on a daily basis. Probably the greatest misconception around public health is the idea that public health is only something done by experts. That is, unless you're a doctor or a PhD or something like that you have no role in public health. That is wrong. Communities and individuals from every role in life can participate in public health, whether it's working with the communities to clean their environment or working with the communities to help people access health care. There are many ways in which everyday people can be involved in a number of public health activities, and this is something that really needs to be encouraged.
I think that one of the big things I always talk about in my career here is that public health is the greatest story never told. So that misconception is that in most cases people only think we inspect restaurants. I think when you look across those different health departments that are truly the professionals that are leading the field, they have, I guess you could say, their staff are involved in all kinds of activities, whether it be infant mortality, substance abuse, immunization, Title X, working with women in need. So I think the misconception is we're very limited, but yet if you stand back and look at our history, in the 28 years I've been there, we're dealing with emergency management issues, we're dealing with sustainability, we're dealing with water quality issues. So you'd see that transformation as public health has grown over the past, in my career, 28 years. I would say public health is always being ready to learn, always being ready to look at the different trends that are out there in the community, and really trying to find a way to solve those unique problems, in addition to maintaining our strong mandated public health programs that have gotten us to where we're at today. And those mandated programs would be food service, our home sewage systems, immunizations, programs that we have a long history in, vaccinations, flu, awareness campaigns. That's kind of what I would look at.
Mental illness in college students. 50% of students rated their mental health below average or poor. 30% reported problems with schoolwork due to mental health issues. 1 in 7 students reported engaged in abnormally reckless behavior. 1 in 3 students reported prolonged periods of depression. 1 in 4 students reported having suicidal thoughts or feelings. Only 7% of parents reported their college students as experiencing mental health issues. 50% received no education on mental health issues prior to college. Mental health education and understanding are public health issues.
Risky behaviors and alcohol poisoning are short-term reports of alcohol use, and long-term usages are monitored and described by public health officials. Without organizations like the CDC, we wouldn't have basic statistics, facts, or information about diseases, health risks, or various other things regarding our lives.
Public health can be defined as the overall well-being of a population. This is different to the approach of traditional medicine, which only focuses on the individual. One can additionally divide the discipline into 3 parts: prevention, community relations, and education. Each of these elements are vital in the practice of public health.
The term prevention refers to risk reduction with disease and injury. There are 3 levels of prevention, including primary prevention, where measures are taken to avoid exposure to the disease or injury. An example would include getting your vaccines. In this scenario, the vaccine prevents you from ever becoming infected with the disease that it prevents. Secondary prevention is an early diagnosis and/or treatment to avoid further injury from the exposure. An example of secondary prevention would be wearing a seatbelt. In this scenario, there is still potential for injury, however, the weight of the risk factor is greatly reduced. Finally, tertiary prevention, where rehabilitation and recovery are focused on this stage.
Community relations plays a vital role in the field of public health. Since we are working with populations, it is important that everybody participates in the programming and/or preventative measures. You can think of it as the community being the individual patient. In order for this to happen, those practicing public health must maintain a positive relationship with the community of which they are serving. This involves respecting cultural norms and ensuring that any studies or programs are completely ethical.
The earliest examples of public health can be traced back to the 3rd century with the Romans' use of aqueducts to safely transport their water.
In 1854, John Snow collected data to find out why so many people were contracting cholera. From data that he collected, he found that people using one of the community water pumps were getting sick, and furthermore connected the contamination to cholera.
An outbreak of cholera would look extremely bad on a report.
Because of this, he's referred to as the father of epidemiology. Public health was popularized in 1918 because of the influenza pandemic that caused about 25 to 50 million deaths worldwide. Since this catastrophe was preventable, people began studying how to prevent another pandemic such as this one.
The first marine hospital, located at Norfolk, Virginia, was purchased from that state in 1801. The second was built in Boston, Massachusetts, and some of the medical personnel were utilized by both the Union and the Confederacy for the care of the sick and wounded of the military forces. It frequently happened that the medical officers of the early marine hospitals were the first physicians to diagnose such diseases as cholera, fever, and smallpox, which seriously endangered the public health at ports of entry. As time went on, the work of the service became of such increasing importance to the public health of the country that Congress gradually extended its duties until it became in function a federal health service.
There are multiple career options for a bachelor's degree in public health. Some of these career paths include, but are not limited to, a community health specialist, a disaster manager, a global health personnel, and/or a health policy manager. With a master's degree in public health, you are able to obtain a job as any of the following: an environmental scientist, a public health nurse, etc.
Students at Baldwin Wallace University get the opportunity to apply things they have learned in the classroom to outside experiences. Students have the chance to compete against other schools in trivia and case study presentations at the National Public Health Scholar Bowl. Public health students also endorse and promote healthy lifestyles across campus, along with educating the campus about relevant health topics.
There are many initiatives taking place at Baldwin Wallace related to public health, like the Tobacco-Free Campus Initiative, Campus Kitchen, and projects in community health planning and health and social justice.
One of the best ways that our public health program connects to the community is through a class called Health and Social Justice. In this class, each group gets matched with a community partner, and we work on writing a grant with that organization in order to support some kind of health need that they have. We've worked with a variety of organizations in the past, including LGBT centers, low-income housing, community development banks, and it's a really good way to put what we learn into context in the community.
This semester, there's also a public health class offered, and it's called Community Health Planning. This year, we're working with Metro Health and their school health program, and we're working with at least 3 or 4 different schools in the Cleveland Metropolitan School District, and we're surveying the students and asking them to take photos of what health means to them in and around their school and what examples of something that might be unhealthy are. And we're doing all this to create a photo voice, which is just like a presentation on a certain subject, and we just want to create something that showcases the students' voice and also lets mental health know what the students think of the school health program, which is basically a mobile clinic or mobile doctor's office of sorts for the students who aren't able to reach a normal primary care physician. Yeah, so it's really exciting, and I can't wait to get feedback from the students.
As you can see, public health is in many facets of our daily lives. Community is an essential part of successful public health projects.